Sibus stands out for its impact and digital format. How does it improve handling and ergonomics for practitioners?
Thanks to the company, we have approached our aesthetic medicine and plastic surgery profession. They provide us some good device. We are on a good level to evaluate the anatomy of the different layers as well as the real location of the vessels. So it was quite good, but it was not what we are looking for. Why? Because the most important point is that the probe was quite linear, quite big, even it just looks small, and the hands was blocked. So it's not so easy to go to our normal daily practice with the fact that we need to inject with the two hands. That's the reasons, thanks to the new gen of this ultrasound device, Sibus, safe injection by ultrasound. At that point, of course, we can prove, and we have now good level of publication, that it liberates the two hands, giving the eyes under the skin, so the very accurate vision of what we are doing, that with the fact that we can inject with the two hands.
You emphasize the importance of ultrasound in ensuring injection safety. How this tool transforms everyday practice?
We have a big problem, my dear colleague. The problem is that we are around 400,000 practitioners, physician and non-physician, with an additional problem, who inject in our profession. And the number of necrosis, vascular compromise, is about 100,000, with a lot. And the number of blindness is on an exponential situation, around 450 blindness a year. So we have a big problem, and the solution was not so big. That's the problem, to answer to this safety. So step by step, we know that the unique, easy way to answer and to fix this problem is the ultrasound guide injection mode. And that's why now we are in this new development.
In the event of complications, what specific role does ultrasound play in diagnosing and effectively treating the problem?
We have now the solution to inject the hyaluronidase if we have this vascular compromise with the risk of necrosis. But the most part of the time, we were obliged to inject the zone who is on the dependence of a certain number of vessels. But now, thanks to the ultrasonography approach, we know exactly what's the vessel who have the real problem. So we can diminish the dosing. We came from 1,000 to only 90 units, with, of course, not so big, with a very, very smart level of efficacy.
What concrete benefits have you observed since adopting Sibus for both practitioners and patients?
So step by step, we can see now, because now we have a huge level of teaching activity with many lecture, article. We are going now to edit the method, the Sibus method on a book. The book will appear just in a few days. We know that the people, they go to a nice vision of what they are doing when they inject, to the fact that they have this possibility to inject, and when they want, they have the possibility to put just on the right hand. If you are an injector, we inject with the right hand, you have the syringe and the needle, and on the opposite hand, you can, of course, assess easily, because this little device is on a very miniature device on your finger. That's it.
In your opinion, could ultrasound guidance become an essential standard in medical practices?
We came from a problem of safety, and we have to remember that concerning not only the filler or the toxin, but on the surgical field with the fat grafting, now it's a law. It's a law when you inject mainly the buttock to document the fact that you have employed the ultrasonic guidance when you have injected on the right layer the fat on the buttock. And we think that more and more it will be a legal recommendation concerning the face injections and mainly also for the filler. Meaning that more and more it will be a standard that we need to use as a normal way in our practice.
What message would you like to convey to readers and practitioners to encourage them to follow this magazine and discover its content?
So why Heritage Magazine seems to be a very promising new media? In our planet, with the aesthetic medicine and plastic surgery planet, we need to use, and it's like that now, it's the new standard, a very high level of communication. And during the first edition, it was dedicated to how to use the tools dedicated to the medical communication in our profession, with absolutely a very specific level of communication. And the second edition now is dedicated to the same employment of a pragmatic way concerning all the tools in direction of this development, but with the employment of the artificial intelligence. So that's probably something we seem to be very promising, so thanks to the newborn, this new media heritage.